Cerebrospinal fluid-venous fistula can be diagnosed using a variety of methods including magnetic resonance imaging and computed tomography scan with contrast, and cerebral angiogram. The diagnosis of cerebrospinal fluid-venous fistula can be challenging because the symptoms can be vague and nonspecific. Therefore, a thorough evaluation by a medical professional is essential. The first step in the diagnostic process is a physical examination and medical history review by a doctor. The doctor will ask about your symptoms, medical history, and perform a physical examination to assess your overall health. If your doctor suspects a cerebrospinal fluid-venous fistula, they may order imaging tests to confirm the diagnosis. The most common imaging tests used in the diagnosis of cerebrospinal fluid-venous fistula are magnetic resonance imaging with contrast, computed tomography scan with contrast, and cerebral angiogram. MRI with contrast is a non-invasive diagnostic imaging test that uses magnetic fields and radio waves to create detailed images of the brain and spinal cord. The contrast material used in MRI helps to highlight the abnormal connection between the cerebrospinal fluid space and the venous system. CT scan with contrast is another non-invasive diagnostic imaging test that uses X-rays to create detailed images of the brain and spinal cord. The contrast material used in a CT scan helps to highlight the abnormal connection between the cerebrospinal fluid space and the venous system. Cerebral angiogram is an invasive diagnostic test that involves the insertion of a catheter into an artery in the groin or arm and threading it up to the blood vessels in the brain. Contrast material is then injected through the catheter to visualize the blood vessels and identify the abnormal connection between the cerebrospinal fluid space and the venous system. In some cases, additional tests may be needed to confirm the diagnosis or rule out other conditions. These tests may include blood tests, lumbar puncture, or other neurological tests. In summary, the diagnosis of cerebrospinal fluid-venous fistula involves a combination of physical examination, medical history review, and imaging tests such as MRI with contrast, CT scan with contrast, and cerebral angiogram. It's essential to receive a proper diagnosis to ensure appropriate treatment is provided.